Good morning, dear members of Smile Bright Root Canal Academy, which is currently known as Mohan's Microdentistry. I am Dr. Abhiraj and welcome you all for this first webinar. Before we start this webinar, let me tell you how I got into this idea. It's been 50 programs since we started this academy, and if you see throughout this journey, I attribute the entire success to you people. Because of your participation and your kind reference, I've been able to grow like this. So I thought, let me do something back for these people, and I also wanted all of us to stay connected, and that's why we started this WhatsApp group, and by God's grace it's going really well. A lot of people tell me feedback that it's working out extremely useful for them. Then I thought, let's go one step ahead, because I always had this plan of having everybody meeting in one place, conducting some lectures for them, not only in endodontics but clinical dentistry, which I used to do, which was called as Access Clinical Meet. But practical difficulty, now we have participants from different places of India. It's not practical for every one of us to meet every month. So that's when I got this idea of webinar. This I am planning to conduct every month so that it will be useful for all the clinicians in different part of the places. Not only related to endodontics, as I told you, this will be in clinically relevant topics by the reputed speakers or the specialists in that particular aspect. So once I decided to do this webinar, the first person or the first topic that came to mind was documentation, and it was because of the person whom I met who really inspired me to be a clinician that I am today. Yes, it's Dr. Seetharaman. I'm really lucky that I met him, and most of the things that I do in my clinic, how I document, how I go through the clinical routine, is because of him. What I learned from him this 4 years that I visited as a consultant over there. So before I introduce the speaker, let me tell you a few things about Dr. Seetharaman sir. He is one person who thinks his temple is clinic. He literally bows down, touches the floor every time before he enters the clinic. That's the kind of respect that he has. Someone sits on the dental chair or keeps his foot over the dental chair, that's all, that guy is finished. So he respects, he thinks that his clinic is temple, and every arm of them in the dental clinic is his tools. So he's such a kind of a clinician, phenomenal practitioner, orthodontics, he does prosto by passion, implantology, and the most valuable thing that I found in him is how he documents his cases. So photography is his passion, the way he documents his cases is phenomenal. So let me introduce you to Dr. Seetharaman, who is an orthodontist, prosthodontist and implantologist from Coimbatore RS Dental Care. So before taking much time, let me hand it over to him. Dr. Seetharaman sir, I request you to take over and start this webinar in your own style. Hope the webinar continues every month. Thank you.
It was an overwhelming introduction. First of all, I would like to thank Dr. Abhiraj for giving me an opportunity to deliver the inaugural webinar of this academy. My heartiest congratulations to you, Dr. Abhiraj, for starting this wonderful academy and motivating younger dentists and myself. I wish you all the best on all your future endeavors. I am Dr. Seetharaman from Coimbatore. I did my undergraduation from Raja Muttaya Dental College and post-graduation in orthodontics from Meenakshi Ammal Dental College. In 2000, I finished my post-graduation and joined my father's 35-year-old practice. Right from day one, the patient expectations were very high as they were used to my father's 30-year-old practice. This gave me the chance to look for perfection right from day one of my career. With this, I am going to start my presentation on documentation and how this documentation helped me to improve my treatment standards. Over to the presentation. So, what is documentation? It is a detailed record of the history of illness, diagnosis, treatment and complete management of a patient. So, it starts with registering all relevant personal information along with their medical records. Then comes our diagnostic part. Right from presenting condition to all clinical findings must be noted. Then we make the elaborate treatment plan and select investigations that might be required. And during the treatment phase, every procedure at every appointment should be updated into the patient file. And finally, but not the very least, the feedback. No matter how well the treatment has been done, never forget to know what our patient says. Self-critique is very important for the growth of our practice. So, why do we document? To promote the quality of our treatment, reducing errors, improving patients' trust and satisfaction, enhancing our performance, and very importantly for patient statistics and publishing of studies. Moving forward, how was the documentation changed? Gone are the days of case sheet writings and indices where eventually we end up with unorganized and tedious paper filing. At current times, every document can be soft copied and every investigations uploaded into a secure patient management program, leading us into the digital age of the patient management where all our patient files are just a few clicks away. But even when all that sounds too simple, do we really do proper documentation? Guaranteed, we do have huge volumes of cases and we do strive hard in creating finesse in all treatment. But is that enough? A nationwide study suggests only 12% of the dentists in Tamil Nadu have even a complete patient record. It also says the three most commonly missed out documents are seemingly very important ones. So, how do you cover our basics first? There is something called a SOAP note. It is a method of documentation used worldwide by most healthcare providers. It is an acronym for subjective, objective, assessment and plan, as you can see. It is quite self-explanatory. By writing notes in all these four headings, we absolutely make sure that we don't miss out on any essential details. We'll just take an example right now just to say how simple the process can be done. Most of us will have a front desk reception equipped with a scanner and a printer. As the patient registers, collect all relevant past medical records and create a file. Make the patient or your receptionist type it into a patient management software. The second it is uploaded, all the data is in your phone or a connected server by your chair side. So, when the patient comes inside, you are well informed and can proceed with evaluating and uploading treatment plan and investigations. All other data like x-rays and prescriptions should be uploaded as the treatment progresses. And finally, the patient will be sent for scheduling and billing with a feeling that you are doing a flawless, streamlined treatment. Basically, I would say documentation is not just about having all the data. It's about improving the quality of your treatment at every step. Even if it is the basic things we do like a study model impression, the digital X-ray systems or the lab and the scan correspondence and the prescriptions. The recent tools for documentation are patient management systems, photography and using a microscope with a good quality camera. As this webinar's aim is to talk more on how to do best kind of documentation, let's see more about the advanced tools. A patient management software is not just about moving your hard copy files to a computer. It has everything to do with how the information flows throughout your office and how it fits into your everyday process. It's about being able to access patient information anywhere in your office and outside at any time. Let's take a computer with a registered patient file. The first step is to make it connected to all your servers, be it multiple systems or your mobile and tabs. Just this part of an online documenting would make your scheduling quick and easy. Will give you very organized and hassle-free clinic time. Very importantly, when the patient looks at you having all the information in hand and educating them on the procedures to be done, it not only makes them content with your treatment but also leads to a healthy bonding. And finally, paperless office with all its files safe on the cloud is even more ideal setting for an infection-free zone. So, how do we choose a good management program? There are plenty of patient management softwares like the Bestoic, Practo, the Complete Exam, Dentist Management Corporation, Dental Care Link available in the market. So, when choosing among so many, we have to keep in mind three important things. The first and very important one is choosing a cloud-based online software so that you cut down the cost on annual upgrades and backups. The accessibility and data security is the best in the cloud-based system. Next, the software has to be flexible enough
to provide you with extra features or add-ons you need as your practice grows and changes. And finally, the management program's aim is to reduce your workload and not complicate it. So, choose a system which can be easily used by any of your staff members and not just one single person. Now, coming to the most indispensable document today, the dental photography. Intraoral conditions in the course of treatment can change so much that within a matter of months, patients and practitioners tend to forget how severe the original condition was. Having photos available at every visit reminds us and the patient of the original situation and makes us improve the treatment with better judgment. With the right skills and photographic methods, our communication with the patient on treatment planning can actually make a huge impact on our performance. So, the first thing to buy is a good camera. The choices roughly fall into the categories based on the individual preferences. But broadly speaking, there are 4 types of cameras available in the market. The compact, which is the basic model, the intermediate one, which is a bridge, the next is the mirrorless, and the higher end, as you all know, is the DSLR. And as you all figured out by now, no compact camera or a bridge camera is even close to the quality of a well documented DSLR photograph. So, make sure you have a basic DSLR with a macro lens of 100 or 105 mm and a ring or a twin flash attachment. This is just an example to show how a 100 mm lens will help you to take focused images from a safe distance. To be well informed on what specifications to look for when buying a DSLR, let us see how important things to know. It's all about good light when it comes to good photos. To achieve optimum level, we have to see 3 important settings: the aperture setting, the shutter speed, and the ISO setting. The aperture setting is expressed in fractions and is called f-stops. So, the basic concept is larger the fractions, smaller the aperture, and so you get a highly focused field of image. An artsy looking photo with just one part focused and the other parts blurred happens at smaller fractions, and it is not ideal for our documentation. Next is the shutter speed. Again, here larger fractions means faster shutter speed and a clear crystal image. And finally, ISO sensitivity. Higher the number, grainer the images. So, stick to ISO 100 for the sharpest of the image. So, ideal take home setting you need is f30, there is f-stop of 32 with 1 by 125 of the shutter speed and ISO of 100 for creating best intraoral photographs. For the extraoral photographs, only difference is to make your aperture setting between f8 and f11. Make sure you also have good quality retractors for retraction, or a stainless steel or a chromium based mirrors, and contrasters for enhancing your photograph. In our practice, there are plenty of situations when you think there is not enough magnification for performing with fineness. So finally, now with the introduction of dental operating microscope, the ease of performance and scope for better documentation have been drastically improved. With a magnification range between 4x and 25x, the use of dental microscope is not just in endodontics but to dental implant placements, restorative procedures, and all aesthetic treatments. A good working posture, self-satisfaction, and a quick treatment is what we achieve by using a dental microscope. So, what are things you must consider before buying a scope? Your scope should have a superior optical quality, LED illumination inside an optic carrier, and not on the moving components. So, a scope which has less wires hanging will help in hygienic workspace. Look out for systems where add-ons are very easy, and eventually if you are buying a scope, take it along with a DSLR or a mirrorless camera for high quality of documentation. A mirrorless camera has several advantages over DSLR when it comes to using with a dental microscope. First thing you will notice, it is far lighter and easier to handle. The lens system provides higher quality documentation by providing faster autofocus, sharper image even when you are shaky, and has a live view screen, so that you don't have to be close to capture focused pictures. With this, the tools of documenting our clinical cases is done, but a complete documentation does not actually end here. Last but not the least, financial documentation. Among all the documentation that we do, the one that we fear the most and procrastinate the maximum is the financial documentation. Having the privilege and comfort of having my wife as my chartered accountant, I thought she can provide a better insight into this topic than me. So here is a short video from her.
I will be talking about the importance of financial documentation in a clinic. Bookkeeping is a very important aspect for any business or profession. This is most often neglected by professionals, especially doctors, and this comes to light only when you go for the income tax return filing and your auditor asks for a lot of details. As a doctor, you are required to maintain a minimum set of records. So firstly is the patient record. As soon as a patient enters your clinic, you have a register. You write his name in the register. It is that simple. That is the patient record. Then comes your cash register. Here you have the name of the patient, the treatment done for the patient and the cash received from the patient. Always maintain a good practice of giving a receipt to the patient. So whatever cash you have collected, maintain a receipt, give the receipt to the patient. Comes your expense file. File all your bills related to your clinic. This includes your dental material purchase bills, your phone bills, your petrol bills and all your bills which are related to your clinic. As professionals, you are at an advantageous position to claim the expenses and reduce your tax liability. So now I move on to the most important and useful aspect is stock or inventory register. This basically tells you what material is available at any point of time. So you know what is in stock and what is not. You should not be running around to a shop or calling a dealer, keeping a patient on the table and looking out for a glove box or a impression material. So this stock book helps you to keep track of the material you are using. Next is the fixed asset register. So what is a fixed asset? If an asset is purchased for a long term use, it is a fixed asset. So this includes your dental chairs, your AACs, your other furnitures and computers too. So maintain a file of all the purchase bills you have kept. So this helps in claiming the depreciation at the end of the year. So this eventually helps you to bring down the tax liability for you. Next, a question arises. How long should I keep these records? So you are required to maintain the records for a minimum of 8 years. Now there are umpteen number of softwares like Practo, Tally, etc. to maintain your records. If you are a beginner, it's better you start with an Excel. It's a very simple software, you just have to maintain the records in that. Next, your tax papers speak a lot about your professional growth. So don't evade tax. You are not doing anything illegal so don't hide your income. A good IT paper and a good record keeping are important for your future expansions and for getting loans from the banks. So be a honest taxpayer and have a peaceful sleep at the end of the day.
So finally coming to the part when I say how much of all the ideal documentation methods I mentioned till now I implement at my clinic. To be very frank, my initial days of documentation were between nil and very primitive. Nothing can be said as a completely documented patient file, but with technical advancements and constant upgrade, I was able to improve my documentation strategies through all these years and thereby my patient satisfaction levels. On the personal side, I have realized how much with every case I have made better judgments and made myself a better practitioner with all the mistakes included. Now we are going to the most interesting part of the presentation, some clinical cases. As I said you before, my initial documentation were pretty ordinary as time catched up and technologically advancement taken place, I was able to do proper documentation. Now I will run through some cases which will start from pretty ordinary documentation to a very good documentation by the end. Let us go through the cases. The first case, this case was done more than 10 years before. It was done around maybe around 2005 or 2006. This is a simple pedo case of fracture incisor edge, and just did a cosmetic, just did a composite filling, and this photograph before, pre and post op photographs were taken with a simple Coolpix, that is Nikon Coolpix point and shoot camera. This is the pre and the post op photograph. The second case is a diastema closure. This was also done around 8 to 10 years before. This was also shot with a point and shoot camera. You can see though the treatment is good and the picture quality is okay, comparatively okay, but the clarity of the picture is not as that much appreciable, and you can note that the presence of calculus, presence of these should be avoided. As days passed, I was able to know all these things and I was able to get rid of these problems. So next we will go to the next case. This is a simple root canal treatment case. RCT is done in a 2.6 with a master cone. It is just a radiographic documentation with a pre-op radio master cone and a obturated image. I do not want to stress most on this, as daily these points are stressed by Dr. Abhirajithan in our academy. This is also a re-root canal treatment case. This is a pre-op radiograph with it is a failure RC done with a master cone, and it is a post-op obturated record. Next, I will start. Next case is a simple implant case. You can see 2 implants have been placed posteriorly, and this has been documented again only with a point and shoot camera. And if I would have had a better camera, you can see how this case would have been, how this documentation would have been. The image is, the case is good, the process is good, but the whole thing is we are not able to appreciate it because of a poor documentation. Now, as years passed, I was able to realize that because of my documentation, I am not able to show my patients very good work. So I bought a DSLR and started documenting, and the stages of treatment also I started documenting. For example, in this case of a RTA, road traffic accident, patient lost anterior teeth, and this is a OPG also shows the exfoliate, avulsed anterior tooth. So what we planned was an implant with bone graft, and bone grafting and implant, 3 implants were placed with bone grafts, and 6 months later the impressions were taken, and this is, I started documenting LAT procedure also. Next is a very interesting case of full mouth rehabilitation. You can see in the OPG there is a failing RCTs with a failing crowns and failing dentition. The pre-op intraoral view shows multiple caries and the ill-fitting crowns. A lot of stains. She is a beetle and chewer. Attrition was there. She was admitted multiple RCTs and few extractions, and she was going for full mouth rehabilitation. All ceramic crowns were used, zirconia in the posteriors and IMAX in the anterior. So this is the post-op view. These are lateral views, occlusal upper, occlusal lower, and the anteriors alone with the contrast. I hope we can appreciate this. See, everybody will be able to do these type of wonderful work, but unless we document it, how can we know ourselves? If we can learn ourselves with the proper documentation, we can improve ourselves with the proper documentation. This case is an excellent example for this, and this is how she smiled. This is going to be the last case of the presentation, the case of total full mouth rehabilitation with implants, and this is an extraoral view of the patient, failing dentition, periodontal problem, and this is pre-op views. This is pre-op OPG. You can see the failing dentition. What was advised, we can all on 6 implants, full arch replacement with the 6 implants in the upper and all on 4 in the lower with the molars remaining, and immediately screw retain process was placed. He was planned a mallow bridge, and this is his post-op immediate loading after immediately after surgery. This is a chrome cobalt framework with a IMAX crown. Framework trial, you have to see the metal trial, that is mandatory, and we have to take OPG with the metal frame. This is where everyone will be missing. We have to take an X-ray with the metal frame that shows the exact fitting of the frame and we have to document the process also. This is the final processes with the model, and this is the final process in the mouth. This is the side views, this is a occlusal view, and this is a finish from pre-op with the failing dentition to a acrylic denture to a Emax crowns on a chrome cobalt frame with a composite gingiva. Hope you can appreciate the gingival formations. This is the side view, and see hope he is giving a happy smile. Lastly, I just want to say a few words on ethics governing documentation. Health information is considered amongst the most sensitive and personal information that individual possesses. In this digitized, paperless documentation process that we are aiming for, there are three major things we must consider: privacy and confidentiality, security breaches, and photographic ethics. The key to preserving confidentiality is to allow only authorized individuals to have access to information. This begins with authorizing users. To prevent breaches in data, security measures such as firewalls, antivirus software, and intrusion detection software must be included to protect data integrity. Mobile phones and other portable devices should definitely have cloud storage, password protection, and encryption. When it comes to photographs, always make sure there is an informed consent, a secure storage, and a minimal anonymity. Boxes or dots or shades over the eyes should be made along with hiding recognizable birthmarks and jewelry. Finally, I would like to conclude by saying that documentation should be made as an integral part of dental practice. With proper documentation, dedication, sincerity, and hard work, we can achieve very high standards in dental practice. I would like to thank Dr. Ilakya and Dr. Vishnu Durga, without whose help this presentation would not have been a reality. Finally, my sincere thanks and namaskarams to my father, Dr. Subramaniam, without whom I am nowhere. He is my first guru of dentistry. I would like to end this presentation with his own advice. Thank you.
My heartiest congratulations to Dr. Abarajidan for starting a dental academy and motivating the younger generation. I wish him all best wishes for a bright future. The success of my 50 years of practice is due to my guru respect and punctuality. Kindness to the patient by giving importance to their complaints. Sincere to the treatment is very important. Grabbing money by exploiting the ignorance of the patient is sinful. Patient's satisfaction and their heartiest wishes are very important. Thank you one and all.